Welcome back to the PTCB Top 200 Drug Series. I'm Izzy, certified pharmacy technician with 9 years of experience. 4 episodes in, you know 40 drugs. Today we're adding 10 more, and this category is one of the most device-heavy on the exam: respiratory medications. This is where the PTCB gets specific, not just what the drug does, but how it's delivered. 10 drugs, 3 classes, 1 rescue versus maintenance rule that the exam tests constantly, 1 device trick that unlocks the entire category, and 5 practice questions at the end. Let's go. Here's the framework before the tricks. Respiratory drugs split into 3 classes. First, bronchodilators. These open the airways by relaxing the smooth muscle around them. Beta-agonists are the main bronchodilators. They come in 2 forms: short-acting and long-acting. Short-acting beta-agonists, SABAs, are your rescue inhalers. Use them when symptoms hit. Long-acting beta-agonists, LABAs, are maintenance drugs. Use them every day to prevent symptoms, never to rescue. Second, anti-inflammatory drugs. These reduce the inflammation that causes airway swelling. Inhaled corticosteroids, ICS, are the backbone of long-term asthma control. Leukotriene antagonists block the chemical that triggers inflammation in the first place. Third, combination products, ICS plus LABA in 1 device. These are some of the most dispensed inhalers in retail pharmacy. Trick 1. The suffix trick. Here are the 2 tricks I promised in episode 4. If a drug ends in terol, it's a beta-agonist. A bronchodilator, albuterol, salmeterol, formoterol. Every single one ends in terol. Here terol? You know the class, you know it opens airways, you know it comes in SABA or LABA form. 3 facts, 5 letters. Trick 2. The device trick. Look at the brand name suffix. If the brand name ends in HFA, it's a metered dose inhaler, MDI. Shake it before use. It needs coordination. Breathe in slowly as you press. A spacer can help. ProAir HFA, Ventolin HFA, Atrovent HFA, Flovent HFA. HFA equals shake it. If the brand name ends in DISKUS, it's a dry powder inhaler, DPI. Do not shake it. Load the dose, then take a fast, deep breath to pull the powder in. Shaking a discus scatters the powder and ruins the dose. Advair discus, Seravent discus. Discus equals don't shake it. This distinction alone answers multiple PTCB counseling questions. Clinical rule: SABAs are rescue. LABAs are never rescue inhalers. Using them in an attack is wrong and dangerous. If a question asks which inhaler is appropriate for acute relief, the answer is always albuterol. 1 more ICS counseling fact. Rinse your mouth after using an inhaled corticosteroid. ICS can cause oral candidiasis, thrush, if the powder deposits on the oral tissue. Rinse and spit after every dose. The exam will ask about this. Now let's lock in the brand-to-generic connections. Brand-to-generic, albuterol, albuterol. Brand names, ProAir HFA and Ventolin HFA. Both are SABAs. Both are MDIs. Both are rescue inhalers. ProAir, pro-airway. Ventolin, ventilation. These are the 2 brand names the PTCB tests most for albuterol. Know both. Salmeterol. Brand name, Seravent Diskus, SEREVENT. It serenely prevents symptoms. Diskus device, do not shake. LABA, maintenance only, never rescue. Fluticasone, brand name, Flovent HFA. Flovent flows into the airways and fights inflammation. ICS, MDI, shake before use. After using, rinse your mouth. Budesonide, brand name, Pulmicort Flexhaler. Pulmicort, pulmonary cort. It presides over your lung inflammation. Flexhaler is a dry powder inhaler, fast, deep breath, no shaking. ICS also comes in a nebulizer form for young children. Montelukast, brand name, Singular. Here is the 1 exam trap in this episode. Montelukast is the only drug in this group that is oral, a tablet, not an inhaler, no device, just a pill. It blocks leukotrienes, the chemicals that trigger airway inflammation. Singular. Singular. It stands alone as the only oral option. It's also commonly used for allergic rhinitis, not just asthma. The exam may test both uses, fluticasone and salmeterol combined. Brand name, Advair Diskus. This is one of the most recognized inhalers in all of retail pharmacy. ICS plus LABA in one device. Diskus. Do not shake. Advair adds air. Maintenance only. Butanide and formoterol combined. Brand name, Symbicort. Sim. Symphony of two drugs working together. ICS plus LABA. MDI. Shake before use. Also maintenance only. Tiotropium. Brand name, Spiriva Respimat. This is an anticholinergic bronchodilator. It works differently from beta-agonists. Tiotropium is COPD specific. It's not used for asthma, once daily. The Respimat is a soft mist inhaler, not an HFA, not a Diskus. A fine mist that's easier to inhale for COPD patients with reduced lung capacity. Spiriva, the spirit of open airways. One puff, once a day for COPD. Ipratropium. Brand name, Atrovent HFA. Another anticholinergic, but short-acting. Atrovent HFA means MDI, shake before use. Used for COPD and sometimes combined with albuterol in acute hospital settings as a 1-2 rescue punch. Think, Atrovents the airways open. Mometasone. Brand name, Asthmanex Twist Holler. ICS. The Twist Holler is a dry powder inhaler. No shaking, fast, deep breath. Asthmanex. Asthma Manager. Rinse your mouth after use. The Twist Holler has a built-in dose counter, which the exam may describe in a scenario question. All right, quiz time. 5 questions, PTCB format. Question 1. A patient is having an acute asthma attack. Which inhaler should they reach for? A. Serivant Diskus. B. Advair Diskus. C. ProAir HFA. D. Pulmicort Flexhaler. The answer is C. ProAir HFA. Albuterol, Sabe, rescue inhaler. Serivant and Advair are LABAs, never for acute rescue. Pulmicort is an ICS, also not a rescue drug. ProAir is the only short-acting beta-agonist in the list. Question 2. What counseling point should be made with Advair Diskus? A. Shake it well before each use. B. Do not shake it. Use a fast, deep breath to inhale. C. Hold it upright and breathe in slowly. D. Prime it with 4 sprays before first use. The answer is B. Do not shake it. Diskus equals don't shake it. Shaking scatters the powder and ruins the dose. Load, then fast, deep breath. This is a device-specific counseling question the PTCB loves. Question 3. A patient using Flovent HFA asks why they need to rinse their mouth after each dose. What is the best response? A. It prevents tooth decay from the propellant. B. It reduces the risk of oral yeast infection. C. It improves absorption of the medication. D. It prevents bad breath from the steroid. The answer is B. It reduces the risk of oral yeast infection. ICS deposits on oral tissue can cause candidiasis, thrush. Rinse and spit after every dose. Classic PTCB counseling scenario. Question 4. Which of the following respiratory drugs is taken as an oral tablet rather than an inhaled device? A. Budesonide. B. Tiotropium. C. Montelukast. D. Fluticasone. The answer is C. Montelukast, singular, the only oral drug in this class. Singular, it stands alone. No inhaler, no device, just a tablet. The exam knows students forget this one. Question 5. A patient has COPD and is prescribed Spiriva Respimat. What is the generic name and how often is it taken? A. Ipratropium, 4 times daily. B. Salmeterol, twice daily. C. Tiotropium, once daily. D. Formoterol, twice daily. The answer is C. Tiotropium, once daily. Spiriva, Respimat. Anticholinergic. COPD specific. Soft mist inhaler. Once daily. Know the brand, generic, device, diagnosis, and dosing frequency. The exam may test any of those 5 facts for this drug. 10 drugs. 3 classes. 1 rescue rule. 1 device trick. 1 oral exception the exam loves to hide. If you've watched every episode in this series, you now know 50 of the top 200 drugs, and you know the reasoning behind all of them. Subscribe for episode 6. We're going into pain management, opioids, NSAIDs, and the controlled substance rules that show up in the federal requirements domain of the PTCB. I've got a schedule trick that makes DEA drug scheduling click immediately. Drop a comment. Which respiratory drug surprised you most in this episode? I read everyone. I'm Izzy, and I'll see you in episode 6.